All right, so the first mistake we're going to talk about is what should I do if my copay just does not sound right? So here's kind of an example. So I had someone that went to the pharmacy, and when you go to the pharmacy, they typically hand you the medication or they lay it on the counter and they say, go ahead and sign for it, go ahead and pay for it. Now, do you have any questions? So someone that I have here, what happened to them is they went to the pharmacy, that exact same thing happened, except for they picked up the medication and they started looking at the medication. And on the medication, it clearly said that medication was a class B medication. Now, this was just a tube of cream. So with that class B medication, right underneath of it, it said, you cannot take this medication if you have, and it listed some other things. Well, that particular person had one of those other health issues, and they were right away not able to take that cream. So they looked at the pharmacy, the person there at the pharmacy, and said, well, I clearly can't take this because it's a class B drug, and I have other issue, another health issue that will react to it. And unfortunately, the pharmacy would not refund that $70 that she had paid for that tube of cream. So be very careful when you're at the pharmacy. Maybe ask any questions before you touch the medications, because once you touch them, most pharmacies won't let you return them, for sure, before you pay for them. The other thing is, what you don't want to do is pay for the medication, walk away for the counter, and then come back, because they definitely won't take it once you've walked away from the counter, and refund your money. So those are just a couple of situations. Now, you being an Extra Care member, if you feel that the copay just does not sound right, something is just not right, you can always contact our office. And what we'll do is we'll go in, try to research with what your insurance plan covers, what your projected cost really is, to make sure we're on the same page. Now, here's another thing that you can do is, let's say that you're at the pharmacy and it doesn't seem right, but you're out of medications, and maybe it's the weekend and you really need to make sure you get your medications. You could always ask for a partial prescription. So for example, that would be like, let's say that you have, normally pick up for a 1 month supply, 30-day supply. You can say, well, can I just get and pay for 3 or 4, let's just say pills, 3 or 4 pills, so I can have a partial prescription until I get this resolved and make sure that I'm comfortable with what's going on. So a lot of the pharmacies do allow you to use the partial prescription. So that's just kind of a little tidbit. So that right there is some ways that you can work around if the copay just does not sound right. Now, remember, you can always contact our office and we can help you if you just think that something does not sound right. Okay, the second one that I see, the second most common mistake that I see is, does my prescription insurance always give me the best price? That is a great question, because to be honest with you, it's not always the best thing for you. So for example, like my parents, for example, when they go pick up their medications, they present their Medicare prescription drug card, whatever company that they're with. And then if you have a discount card, like in your case, all of you have the Fresh Benny's discount card, as well as a lot of clients, they have that Good RX card, because the Good RX a lot of times sends you the hard plastic card in the mail. So what you can do is just go to, your pharmacy and say, hey, I've got my Medicare prescription drug card, I have my Fresh Benny's card, and I have a Good RX card. Run all these through the insurance and tell me which is the cheapest. Run all these through the Fresh Benny's, the regular Medicare insurance card, and if you have another discount card, and tell me the best price. Because I've had clients that with their Medicare prescription drug plan, maybe the prescription was, I don't know, let's say $30. But if they use the Good RX card, it might be like $7 or $8. Or if they use Fresh Benny's, it might be $7 or $8. So it is not always guaranteed that your Medicare prescription card is going to be cheap or cheaper than a discount card. So I had someone send in a question a little bit earlier before we started the live cast. And one of the questions that he had for me was, hey, Suzanne, when I was on my regular group plan, they covered one of my medications. And now I went on Medicare prescription drug plan, and that particular medication is not covered. Now, here's the situation. I recommend that you use your Fresh Benny's discount card at the pharmacy, or you can go out to like goodrx.com and have them print off a coupon or have them send you a hard plastic card. It doesn't cost anything, because that particular client that sent me the email, that drug that's not covered on his Humana drug plan, it was $77 if he would go buy it outright at the pharmacy. But if he used, his like a GoodRx card or a Fresh Benny's discount card, realistically, you can get it for like $7 or $8. So just know that not always is your your Medicare Part D prescription drug card the cheapest way for you to go. So once again, I say carry the cards with you, present them to the pharmacy. Remember, they're not stackable. So it's not like you're going to get the Medicare insurance rate and then a discount on that rate, they're never stackable. It's either you're using the discounts card or you're using the Medicare prescription drug card. All right. Number 3, is there a cheaper alternative to my prescription drugs? Now, I'll tell you what, to be honest with you, I see a lot of expensive medications. I had a client just yesterday, her and her husband are brand new clients coming to me, and they're both taking significantly expensive medications. So while I was going through and trying to determine which plan was the best plan for them, both of them were on super expensive medications. They were going to fall into the donut hole, which is obviously very expensive on expensive medications. So what I did is I recommended that those clients reach out to their doctor. So sometimes there's not always a generic medication for the drug that you're taking. So let's say that you're taking an expensive medication. There may not be a generic for that medication. However, some medications, there could be a therapeutically equivalent drug, which means there could be a generic that works the same way. It's just a different drug. So if you're taking a medication that's an expensive medication and it is not, there is no generic for that, you can always talk to your doctor and say, is there a therapeutically equivalent drug? So that's kind of the key words, therapeutically equivalent drug. So then it would go in as a generic, and in most cases be less expensive for you. So an example would be many of my clients are on the drugs Eliquis or Xarelto. Those are 2 drugs that are very expensive. It's a blood thinner medication. Now, a lot of my clients, so when I see the Eliquis or the Xarelto, when I see that drug on your drug list, I know right away that you're going to fall in the donut hole. And we're going to talk about the donut hole in a later live cast. But needless to say, so there is no generic for either one of those drugs, Eliquis or Xarelto. But there is a therapeutically equivalent, which is called Coumadin or warfarin. Now, one of the biggest differences, for example, if you take the Eliquis, it's a blood thinner, or the Xarelto, which is a blood thinner, you do not have to get your blood tested because it equals out, keeps your blood thick enough, thin enough. You don't have to go in and get your blood tested every couple of weeks. But if you was to move to, for example, Coumadin or warfarin, yes, it's much, much, much cheaper getting those prescription drugs, but you have to go in for testing every 1 to 2 weeks to make sure your blood is thin enough or thick enough. Now, they do have an at-home machine. It's called an INR machine where you can test your own blood at home. That is something you need to discuss with your doctor, because not everybody could move from Eliquis to Coumadin or warfarin, for example. So you have to talk to your doctor to make sure or see if that drug would work for you. So once again, when you're going through your medications, if you're on an expensive medication and there is not a generic for it, ask your doctor if there is a therapeutically equivalent drug. So that's kind of the keywords, therapeutically equivalent. So it's going to work for the same purpose. All right, number 4. Can my prescription drugs be administered in a less expensive way? So here's an example. When I have a client come to me that is turning 65 or just coming off their employer plan, and they say to me, well, Suzanne, I'm taking, let's use an example, like a Humira. Humira is a drug that's a self-injecting drug. You're injecting yourself with that medication. If you're taking Humira, that goes under the prescription drug plan because you're self-administering it. Sometimes, once again, there might be another therapeutically equivalent that you could have administered in a facility. So now instead of you injecting it yourself once a month or however your prescription reads, maybe you're going to a facility and having that prescription drug administered at that facility. And then the way it works is it goes under the Medicare Part B side versus the prescription drug side. So some medications, that is the situation, is it can be administered in a different manner. Another one that's very, very common is insulin. So I've had clients come to me and say, hey, Suzanne, I'm on insulin, but my insulin is just so expensive. And I need to know if there's a better option. And here's your option. If you are on an insulin pump, to where the pump is attached to the body, so your insulin is going in through your insulin pump, then that insulin and the insulin pump goes under the Part B of Medicare, which means your medical coverage, not the pharmacy coverage. So for example, I had a client come in, it's been a couple of years now, and he was explaining to me that he was on insulin and it was super expensive. He was already on a plan. He had just been referred to me for me to review his plan. And when he came in, he started telling me all about his insulin and all the money he paid for his insulin. And he did not indicate to me that he was on an insulin pump. And it was interesting because he stood up, and as he stood up to, like, I'm not sure what he was doing, but anyways, when he stood up, I could see like some wire hanging out of his shirt. And I was like, are you on an insulin pump? And of course he was on an insulin pump, but I did not know that because he didn't tell me that. So come to find out that on his current Medicare plan, he was paying all of his insulin under the drug side, not the medical side. So there's some situations to where if you're taking insulin where you're doing the shots yourself, you may want to talk to your doctor and say, does it make sense for me to go on an insulin pump? Because with an insulin pump, therefore it's going to be billed under the Part B of Medicare, which in most cases is a much, much less expensive for you. So that's my number 4. Number 5. Does the pharmacy always know the best way to bill my prescription drug plan? The answer is not always. So I'm dealing with a situation right now. The client called me up and they said, every time I go to the pharmacy to pick up my prescription for my testing strips, I'm having to pay this high out-of-pocket cost. And I don't understand why I'm paying this high out-of-pocket cost for my test strips, because on my plan, you told me it would be covered under the Part B of Medicare. Well, come to find out, when you started digging into it, come to find out when the client went to the doctor's office and had the prescription written, if it's a prescription like insulin that attaches to the body or like test strips, on the prescription, the doctor's office must include on the prescription DME, which means durable medical equipment. So if your doctor does not put on that prescription for like test strips or any drug that's attached to the body, for example, insulin, if they do not put DME or durable medical equipment on that prescription, and they send the prescription off to Walmart, CVS, Kroger's, whatever pharmacy you use, that pharmacy is only going to bill it under your prescription card, which is part D as in David, not under the B as in boy, because the doctor's office did not indicate DME. So it is very, very important. If you're taking a prescription drug that is attached to the body, for example, insulin, or like test strips, for example, or really just any durable medical equipment, the prescription always has to indicate on it DME. And if it's not indicated on the prescription, the pharmacy does not know to bill it under the part B. They will automatically bill it under the part D. So the guy I'm working with now, well, I had a lady with a test strip issue within the last couple of weeks. I had another gentleman with a prescription drug issue, which was the insulin. I called and talked to the pharmacy, and the pharmacy kept telling me, well, his prescription drug, this is his cost of the prescription drug. And we went round and round and round until we finally come to the conclusion that that prescription drug did not have DME on it. So once again, if he goes to the pharmacy and he picks up that medication and they bill that under the part D side, the drug side, and it should have been billed under the B side, the medical side, we're not gonna be able to get that money back. I mean, we can argue and we can try to, explain that there was an error, but the likelihood of getting the money back is just not, it's just gonna be difficult to get it back. So once again, this kind of goes back to, if the copays don't sound right, don't just throw all the money and say, okay, I gotta just get whatever. Try to get a partial prescription, because us trying to get the money back is gonna be extremely difficult. So one of the other questions that, or I guess more statements that I have is on the prescription drug plan, if you was to go out on Amazon, like I had a client went out on Amazon and they were buying their test strips through Amazon. If you go to Amazon and buy test strips, that's not getting applied to your prescription drug plan. It's not getting applied to your deductibles. It's not getting applied to your copays or anything like that. So I just kind of wanted to let you know, if you're buying something through Amazon or a Canadian pharmacy or something like that, that does not go towards any part of your Medicare prescription drug plan. Looks like we have a question here. Tisha, go ahead.
Okay, question is, I have a prescription drug that was $30 before Medicare, would be over $200 after Medicare. Costco will fill it for just under $30. Does that monthly $30 go toward my Medicare RX deductible?
That is a great question. So basically the way it works is, if you are paying a cash price at Costco for that drug. So for example, the Costco says, hey, I'll give you that drug for 30 bucks. If that's the cash price, that money will not go towards your deductible. The only money going towards your deductible is if you run it through your prescription drug plan. So sometimes I've had clients that will say, okay, the first couple months I'll pay a much higher out of pocket just to hit my deductible. And then once I hit my deductible, the copay drops down, to such a lower level that it makes sense for me to go ahead and pay the deductible versus paying the cash price at Costco, for example. So once again, if you buy it using the cash price or a discount card through like Fresh Bennies or GoodRx, none of that money is applied towards your deductible. Great question. Do we have any other questions? Because I pretty much went through all 5 of the common mistakes that I see made at the pharmacy. Of course, we're always here to help, but these are the things I kind of wanted to address, here up front. Is there any other questions that anybody has for me?
Suzanne?
Yes.
Okay, we have just a couple that had came in before. You addressed 2 of them, but there was a couple more. So one of the questions is, how do we better manage the prescription cost?
Okay, so that's a good question as well. So every single month, you will get a note, some type of a notice, and it's from the insurance companies. On the back of those mailers that you get, it's like 2 or 3 pages, and it typically shows you how much you've paid out of your pocket, how much has went towards the deductible, how much are you paying right now, how much do you have left till you're going to the donut hole. So you can always kind of foresee or forecast, basically based on what you're getting, those notices that you get regarding your expenses. Now, what you can do is, like, when we review your plans every year, we send you a copy via email of what your projected costs are going to be. But that's your current medications. So another way to do it would be, like, if you're wondering, well, my doctor just put me on this medication, what's that amount going to cost me? There's a couple ways we could do that. If you call the pharmacy, they're going to tell you that they can't tell you, because they have to have the prescription and they have to run the insurance before they can tell you. So the way that we can help you with that is we can tell you what tier that prescription drug is. So every prescription drug is labeled by a tier 1, 2, 3, 4, and 5, typically 5 tiers. The lower the tier, the least expensive the medication. The higher the tier, the more expensive in most cases. So what we could always do is look at the formulary, which is a list of covered medications that your current plan covers. We can take a look at it and see how that drug, or what tier that drug comes up at, whether that be a tier 1, a tier 2. So you have an idea what your copay is. Now, one thing, because of HIPAA, we don't see that if you've met your deductible. So we don't know that. Okay. So we call your insurance company. They're not going to tell us because it's a HIPAA violation. So I don't know if you've hit your deductible, but we could always tell you what tier that prescription is, what your projected copay would be with that particular medication. Another way, now this is kind of like just what I've done with clients, is I just jump on like goodrx.com or Fresh Bennies, type in the medication, and it kind of gives me an idea what the cash price is using their discount. So that's a way that you can kind of manage what your projected costs are going to be on that medication. Looks like we might have another question. Maybe not.
Okay, so it's more of a comment. So it says, I have a prescription that has always been at no charge. I went to Walgreens to have it filled and was surprised that they want to charge $20. They said the insurance said it has to go towards the deductible. The prescription has never had to do that before.
Okay, so if I understand the question correctly, you've always had the zero cost at the pharmacy. I'm assuming that was through the insurance, but I could be wrong. So I guess maybe we might have to have more of a one-on-one conversation so I can get more in depth of the medication. But needless to say, so when you go to the pharmacy though, you can tell them, I don't want this ran through my insurance. I want to pay the cash price or whatever the cheapest is if I have my discount. Now, if they run it through the insurance, they have to charge you with what the insurance is coming back at. So that particular question, I guess I would have to know, it was a zero cost, but how is it being billed? So I'm not sure who asked the question, but if you want to send me an email or give us a call and chat with me about that, I can get a little more in depth with that question. Okay, another question?
Yes. Question is, I need to know about how my doctor should write a prescription for my Victoza, which is not insulin, but an injectable. Once I order it, I'm already in the donut hole, and with my Jardiance, I'm at $1,000.
Yeah, unfortunately, Victoza, you're right. It is an injection. It's not insulin. I don't know. Of course, I'm not a doctor. My disclaimer: I'm not a doctor. I don't know if there's another therapeutic equivalent drug for the Victoza. I also don't know about Jardiance. Most of the diabetic medication, not all, but most of them are brand name medications because they're fairly new, so they're expensive. Now, here's my recommendation is talk to your doctor about going into the donut hole. Okay. When you go into the donut hole, doctors may not understand the intricacies, the exact numbers of how you get there. Of course, a lot of times they don't know all of your medications, but there's a couple things that they do know. They do know, number one, that when some people fall into the donut hole, it's so expensive that they either quit taking their medication or they start cutting their medications in half, which obviously causes other problems. So what I would do is talk to your doctor, explain to him or her, I'm in the donut hole. I can't really afford this. Is there any alternatives? Is there another therapeutic equivalent drug that you're willing to try to see if it would work? And just kind of get their feedback on what they think that might work for them. But be upfront with them and tell them you're in the donut hole and it's so expensive for your medications. Great question. Looks like we have one more question here.
Yes, ma'am. Question is, how do I get a new Fresh Benny's card?
To get a new Fresh Benny's card, you can just contact our office, and what we'll do is we'll put you in contact with Fresh Benny's. We can order, or we can actually, I think, order a new card for you. I have to be honest, I don't know if we can do it for you or not, but Alice would know that. So I'm going to let Alice answer that question because she's the one kind of working behind the scenes on that.
Sorry about that. I was trying to unmute. Yes, we can definitely order a new card for you. So if you post a message on here, I can take care of that right away. Just let me know who you are and we can take care of that.
Perfect. Thank you. That's why I have a great team behind me. So they are always here to help. So once again, I might not know every single answer like that, but they're an amazing admin team that definitely will take care of you in every way. Is there any other questions I can answer today? It doesn't look like it. Looks like we're good. If you guys have any questions, always feel free to reach out to us in every way. Now, oh wait, looks like I have one more question coming in.
Yes, ma'am. Let's see. I'm not sure how to pronounce this, but I'm going to give it a shot. So, is Jacophy covered by Medicare Part D? Not taking it yet, but may have to. It's $16,000 a month.
Okay, I'm not sure who posted that question, but whoever posted that question, you can see that, Tisha. Please call our office because what we need to do is we need to take a look at that medication. I'm not familiar with that, just the name of that drug, but we can definitely take a look at it. Obviously, see how it's administered and try to give you the best advice on what we should do with that prescription drug. So feel free to give us a call at the office and we can answer that question for you.